Now, most of the restrictive measures pronounced by the federal government in its bid to tackle the spread of COVID-19 have been relaxed. On Sunday, for the first time in weeks, religious centers like churches resumed gathering according to the federal government's directive. Most of them follow the guideline for resumption outlined by various states. As a condition for lifting restriction, the federal government had directed that states take up the fight against the deadly coronavirus individually, with an approach developed by them to check spread of the infection. But how capable are states in handling this pandemic, especially when it comes to testing and financing of disease control? Joining me via Skype is Tuyime Bawadu, Public Health Specialist, Band CEO, Medway Health Limited. Thank you for joining us on TVC Breakfast. Now, the concerns have arisen with regards to this step being taken by the government, asking states to take the lead, especially with ensuring that they ensure the fight against COVID-19 is brought to the barest minimum. But questions have arisen with regards to are states able to handle this, especially from what you have monitored?
I think, honestly, it is going to be a huge challenge. Now, let's track the evolution of the cases of COVID-19 in Nigeria. At the end of February, we had about 2 cases. By March, we had gone to 135. At the end of April, it was 1,900, or close to 2,000. By May, we're having more than 10,000 cases. You can see the geometrical progression of these cases. Now, like Riley pointed out, there are core things, there are core issues. The states, do they have sufficient money to do testing? Okay, Lagos has spent about 800 million trying to do testing all this while. Do they have capacity to do isolation? Do they have, the requisite human resources to do, and data collection ability? Let's face it. Very, very few states in this country have the capacity in terms of finance, in terms of human resources, in terms of provision of isolation centers and monitoring. Now, we have to centralize all this data to have a global perspective or national perspective of what is going on in the country. And the right level of government to do that will be the federal government, while monitoring and coordinating at the level of the states. It's going to be quite challenging for states that barely have 100 doctors or even few laboratory technicians to be able to follow up in this regard.
So invariably, what you're saying is this is not the right step to take. It is not in the right direction for the country.
It can be. You cannot just throw this duty to the states, because there's no state equivalent of Nigeria Center for Disease Control. Okay, what you have at the states are the primary health centers. How many of them are working out of the 200,000 available in the country? How many of them are working? How many bed spaces do we have? Okay, now some states are considering, isolation at home. How feasible is that? Okay, for instance, you want to do isolation at home in a place like Lagos. How do you do it at, Saleko? How do you do that in Makoko or even Ajegunle? It's going to be quite challenging. We expect the federal government to lead, because this is a pandemic, okay? We expect the federal government to lead in this regard and, define clear-cut uniform instruction to the states in terms of monitoring and containing the infection. Now, if you leave that, for the individual states, and any of the states falters in its responsibility, what will now happen is that the disease will spread, because there are no boundaries between states in Nigeria. You cannot say that. For instance, somebody in Lagos cannot move to Kano. You cannot say that somebody in Kano cannot move to Sokoto. So there are no boundaries. So again, how do you now, individualize this kind of thing? Yes, there are aspects of the whole thing that is given to the states, to monitor, to look at. But you cannot, just wake up and decentralize and hand over the handling of COVID-19, control of that pandemic, to states. Okay? Because you look at it, how many doctors do you have in Kogi State, for instance? How much fund is available for them to put into the health system? The finances of the states have been compromised because of the fall in revenues from the federal government. So how do you want them to deal with those things?
All right, very pertinent question there. Tuyime Bawadu, thank you for speaking with us. Joining me via Skype is Tuyime Bawadu, Public Health Specialist, CEO, Medway Health Limited. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Now, one of the reasons the Presidential Task Force gave for this move by the federal government is that the communities are in the state, the local government, the traditional rulers, the religious institutions, traditional institutions are all within the states. These communities are within the state. Isn't this a valid argument on the part of the government?
Well, it cannot really be a valid argument because the role of traditional rulers, the role of the community is not to fight epidemics. Epidemics and pandemics are supposed to be structured and fought at the level of the central government. The coordination should come from there. Now, look at what you are talking about, enforcement of or restriction of movement, and enforcement of lockdown. This restriction of movement, interstate movement, is a federal government responsibility, okay? And because, if you now sit down to the state, what happens, Then look at the distribution of palliatives. The SME, the small business individuals, this has to be, we have to see a lot of government input into that. Now, federal government cannot wake up, because now, if you look at the metrics, if you look at the science, from March to this time, in March, we have 135 cases of COVID. By today, we have more than 12,000. That is more than 100% increase. The metric that will allow federal government to say, listen, state, go and handle, should be such that the cases must be coming down or stabilized. And then there must be a clear-cut protocol given to the state to handle so that you can get uniformity. We know that human resources for health, because look at it. We're in a country where we have just barely 50 beds per 100,000 people in this country. We are a country where you have the human resources for health, doctors about 35 per 100,000, pharmacists about 12 per 100,000. How do you want a state that is so short in human resources for health to handle COVID-19, such a pandemic with that ramifications and impact on every aspect of human life? Now, like I said, what is the state equivalent of Nigeria Center for Disease Control? Is there a state center for disease control? Now, what is the capacity of even the primary health care centers, which are not utilized mainly? They are not utilized. What is their capacity to be able to handle those things? So because what this thing is going to show is that, well, the federal government has tried. That would be the perception, and they could not control the thing. Now they want to have an excuse to exit.
But we have seen other countries take up this measure. You look at the US, this is the same step it took, talking about every state managing the crisis as much as possible. But what lessons can we learn from the US, for instance? What lessons that we can apply to ensure we flatten the curve if this is the step or this is the way we are going?
Now, again, bringing U.S. as an example to copy is honestly, dishonest. Now, you know the level of human resources for health in U.S., you know the level of coordinations and information movement. In Nigeria, what is still thriving is a lot of rumors. Up to today, quite a small number of people really still believe that it's COVID-19. The doubt is so pervasive. Now, we're not dealing with that. And then you want to say, state, go and hand over. Now, even we're seeing people doing parties, the religious people don't believe in your face mask. So again, how do you now send the control or even the management of COVID to those levels? Now, well, to flatten the case, we've seen that our push has been that, okay, let's do a lot of testing and know what is going on. But the cheapest means still remain those preventive measures that can be done. Now, the state needs to, enhance the capacity of the local, of the primary health care centers. We need to enhance their capacity. As we're transiting from federal to state level, We will need to enhance their capacity. Government need to look for funds, at least from the 1% consolidated budget allocation of federal budget, to disburse those funds to the primary healthcare centers and then strengthen them to be able to function. If you just walk away like this, everybody will think that, yeah, you cannot handle it and they're on their own.
All right. We'll leave the conversation here now. Thank you for speaking with us.